Today, I would like to present our initial experience with single-incision endoscopic thyroidectomy via axillary approach. With technological advances, minimally invasive surgery has been continually increasing in proportion in treating thyroid diseases, including cancer. Since 2009, we have been conducting single-incision endoscopic thyroidectomy via axillary approach with low-pressure gas inflation. In a previous pilot study, we have reported that SIET is a safe and feasible procedure for PTC with less postoperative pain and better cosmetic satisfaction than conventional endoscopic thyroid surgery. The purpose of this study is to evaluate the long-term outcome of patients who are treated by SIET for thyroid cancer in terms of both surgical and oncological aspects. Between June 2009 and July 2012, 109 patients diagnosed with thyroid cancer underwent SIET at Bucheon St. Mary's Hospital. 81 patients received unilateral thyroid lobectomy, and 28 patients received total thyroidectomy. We retrospectively reviewed the clinical pathological characteristics and the long-term outcomes. All statistical analyses were done using SPSS software. Students' t-test was used to analyze continuous variables, and chi-square test was used for categorical variables. This is an overview of our surgical procedure. A 2 to 2.5 centimeter sized incision is made along the lateral border of pectoralis major muscle. The single port system is prepared by a handmade glove port using double ring wound retractor and 3 trocars. The strap muscles are externally retracted in order to provide better visualization of the surgical field and to secure maximum working space. Patients in total thyroidectomy group had larger tumor size and showed more multiplicity, lymphatic invasion, and higher number of positive lymph nodes, therefore suggesting more advanced disease. Patients in total thyroidectomy group had longer mean operation time and more estimated blood loss than those in lobectomy group, which was expected. Although statistically not significant, there were 5 recurrent cases in the lobectomy group while there were none in the total thyroidectomy group. Of the patients who received unilateral lobectomy, 3 had recurrent disease in the contralateral lobe and 2 had metastases to lateral lymph nodes. 1 patient in total thyroidectomy group who had previously received lobectomy for papillary thyroid cancer underwent completion thyroidectomy for recurrent disease, but had no further recurrence thereafter. In this study, overall 7.3% of patients experienced postoperative complication and 4.6% had recurrent disease. Those who reported hoarseness, high-pitched tone impairment, paresthesia, or hypocalcemia only had transient symptoms. None of the patients had permanent injury. According to literature, the reported complication rate for conventional open thyroidectomy is 7.74%, and the recurrence rate for papillary thyroid carcinoma is 8 to 28%. SIET via axillary approach is a safe and feasible method with comparable surgical and oncological outcomes compared to conventional open thyroidectomy. Thank you for your attention.